Welcome back to the Nafeesa Dangor Show, where, of course, we're enticing you into different spaces. And, of course, let's not forget educating you as well. And we just had a very inspiring conversation. I'm starting to lose my words here because it was so interesting with Wasim Kamruddin from the Asia Times. But now we have something that I think all of you need to sit down and listen to, a very educational segment, and it's got to do with COVID-19. With me on the line, and I'm going to tell you a little bit about the lab that we're actually featuring with Dr. Patrick Mufolo, who is the clinical psychologist at Hamadi Lab. Now, let me tell you a little bit about Hamadi Lab. Their pathology services is a fully automated and computerized pathology laboratory with the latest and most modern equipment available today. Made up of a dedicated team of pathologists, laboratory technologists, and qualified phlebotomists who provide comprehensive, high-quality, rapid response laboratory testing at affordable prices. Hamadi Lab uses advanced technologies to provide information that is critical to the diagnosis and treatment of all diseases. They provide screening, diagnosis, and of course, give you nursing homes, insurance companies, clinical trials, research groups, and various institutions in South Africa is who they team up with. And a very good afternoon to you, Dr. Patrick Mufolo.
How are you, Nasa?
Thank you so much for joining me this afternoon on the Nafeesa Dangor Show. It's so good to see you. How are you doing, Dr. Mufolo?
We're all good. We're all good. And you guys over there?
We're all doing well, thank you. And we're so excited to want to chat to you this afternoon. And you're going to teach us so many different things that I think we need to be aware of as far as COVID-19 is concerned. Talk to us a little bit before we even go into that about yourself and Hamadi Lab.
Great. All right. So, Hamadi Lab is a clinical pathology laboratory, fully fledged lab covering 7 provinces now in South Africa. I'm one of the consultant partners at Hamadi Lab. So, we've been in pathology game for almost 10 years now. We're covering big space in South Africa. We're busy doing DOH COVID-19 testing in Johannesburg and in the entire province. We're helping the SCAM group as well with the COVID testing. We're running big group like HSP. We're doing Cape Medics. We're doing this big Netflix actor that are running their movies in South Africa. We also associated with Emirates. We're running all their travelers with COVID testing. So that's on a side of a PCR laboratory. But we have integrated laboratory, integrated laboratory of hematology, chemistry, and microbiology, whereby we're giving our service to most of clinicians in South Africa. So the idea of Hamadi Lab, when we started in 2010, we were looking at the underprivileged area where GP, they were not getting good services. And then we went over there and we recruited a lot of chronic people, chronic patients. Remember that time there used to be a stigma when someone is HIV positive. They used to hide. They didn't want to go to see their doctors. They didn't want to go to collect their medications. So we break that stigma by saying, okay, now it's fine, guys. We'll come to your home. We'll collect your blood. We'll run your tests. We'll go to your pharmacy. We'll collect your medication. We'll bring it to you. So we break that stigma, and patients are getting used, from the township, from the rural area, and then we grow, and then we went to another province. Now, boom, it's big in Johannesburg, in Cape Town, in Durban. So yeah, we mostly a leading force in pathology right now, and we keep growing. Yeah. Basically, that's an
I think
element of Hamadi
I
Lab.
think it's
It's a
so
team.
phenomenal, Dr. Mufolo. It's so phenomenal to see that, doing those HIV tests. And when people were feeling so afraid to actually go out and do it, you were actually going out to them and doing the test for them, which everybody else isn't doing. So it's such a nice, selfless act to see that you're going to go. Hamadi Labs is actually going that extra mile to help those people out there.
Yeah, definitely. It's actually a good act that I'm sure I'm happy you have noticed that. Most of the big pathology company, they didn't want to take that risk. Remember when you're talking about this rural area in South Africa, you're looking at all the insecurity, you're looking at, people with the poor, they don't have money. And nobody want to give them proper service. We were there. Okay, it's fine. Let's go and assist the people and reduce the price so that it can be affordable today. Most of those people, even though they have medical aid, they are on those small scheme medical aid, so nobody give them service. And you look at the GP that's helping those people as well. It's also struggling type of practice on GP. So we look at that gap and say, let's assist them, let's grow together with them, let's give these people the service that they need. And the people are being appreciative, and the GPs, they say, oh, okay, so you guys are coming to us, this big company, they never come and give us service. And yeah, that's it actually. We took a risk,
It's
and
yeah.
it's worth us today.
And I think it's such a nice selfless act because, I mean, if you look at the people in the rural areas and in the townships, the availability and the affordability is the biggest issue. I mean, for them to actually go out to try and do a test alone is so difficult. So you going out to them has made their life so much easier, but you've reached out to them in such an important level.
Correct. Yes, it actually brought a lot of joy to them, not only to them, but to also to the clinician that taking care of, taking care of them, and also I think another factor it became more cost effective. Remember, I'll pick up a village like Kanyamasa. That is in some rural area in Pumaland. Where a company, one of the biggest company, the pathology company in South Africa, they were going to that village once a week. I mean, it's very,
Yes.
not convenient to the population. So if you need the blood to do your blood on Tuesday, Wednesday, you have to take a taxi or all journey to go to Nespresso and get tested. Then we says, no, this is not going to happen. So we went to that village. We put our settings and we're giving the people service every day. They are happy, low costs. They don't have to travel, the comfort of their village, and they are happy.
That's amazing. Let's
Yeah.
talk a little bit about COVID-19. How did you reach out to the people during that period? Because it was something that is important and it's affecting us right now, also as we speak. Talk to me a little bit about that.
Yes, Nafisa. With COVID-19, we become a little bit more. We become really a key player in this game since March already when it started. So when it started over, most of us were not ready. So we are a team of young, dynamic, guys, and with our complementary skills, we have CFOs, accountant, we have a nurse, genomic nurse, we have a pathologist, we have a scientist. So we come together and then we say, okay, how can we tackle this myth? And we say, okay, no problem. People are young and we are ready to help the country. We were doing house call. So you
Wow.
don't need to come to us to get tested. We come to your house. When the nurse comes to your house, we'll swab you, bring the swab to the lab, test you, we get you an SMS, you get your email, we inform your clinician. It was hectic, but we get so popular because of our house call. I mean, we were helping a lot of hospitals, Netcare, Blowback, here and there, for their admission. We told them, all the physicians, do not panic. Carry on with your service. Let us help you. Okay? So your patient doesn't have to come to you. We'll go to your patient. We'll solve the patient. We'll bring the result to you. And they were so happy, and to make life easy for the patient, for the clinician, and yeah, and it was very fulfilling for us as Hamadi Lab. And then in March, end of March and April, the big company, this came, they approached us, they said, listen, guys, we heard that you guys are doing well. Can you assist us? So we partner with them, and Department of Health come and see us. We give them some of our capacity, and then we have queues, the community itself, and all our branches. There were a lot of queues. We did not reject any single person compared to the biggest conventional pathology company. We were accepting everybody and try to accommodate everybody and see we maximize on every single capacity of testing we had for our people.
I think it was phenomenal because you've reached out to people, like you say, by doing house calls, which nobody else was doing in a hurry. And I think you've made it so much easier. And you've also stopped that element of going out to spread. Because, I mean, if somebody has to go out to maybe a GP or a hospital, they have to go out there. They're coming into contact with many other people. And the element of spread, of course, gets worse. So you've also taken that into factor, but at the same time, you've been so selfless by helping these people where maybe they're in a position where their COVID is in such a bad state that they can't even move, and you've gone out to them to be able to help them out. It's, I think, absolutely phenomenal. Let's talk about COVID-19. I know there's two differences. What is the difference between a normal COVID test and an antibody test, and what sort of functions do they perform?
Okay, cool. Before we move to that question, I just want to add another element. Do you know that we were the first innovative people to start a drive-through in this country during the pandemic?
I think that is absolutely phenomenal.
The first drive-through COVID test was done by Hamadi Lab, and then other labs started copying it. Anyway, all right. So
I think you need a shout out for that. That's absolutely phenomenal. I think for myself and the team, we want to commend you on the amazing work that you did. And you so selflessly put yourself in the front, and you're a frontline person, and you went out and you went to go and give your service.
Thank you, Nafeesa. Thanks a lot for that. Great. So, getting back to your question, yes, the COVID testing, most of people, they don't understand it, right? And it's a new thing to us. It's a new thing to even the SANAS, the SANAS group. It's a new thing for many people. So it's been an experimenting phase for everybody. Okay. So your question is: do you want to differentiate between a PCR testing, which is the actual recommended COVID testing, and there's also another part of it, another method that people are calling COVID SARS-CoV-2 antibodies. So your diagnostic tools for COVID-19 is the PCR testing, which is a polymerase chain reaction. Okay, is where it's that on a simple terminology, we are detecting or identifying the virus from the gene level.
Okay.
So not on a cellular level, okay, not on a tissue level. We go down on a gene level to identify the virus, okay, and we use the method called real-time PCR. Okay. That's the only method that is recognized worldwide to diagnose SARS-CoV-2 virus. Okay.
Right.
Now, looking into the antibodies, normally the way your body is operating is that if any foreign body enter your system, your own immune system will try to mount a response to fight that foreign infection in your body.
Right.
Okay. The process of mounting that immune system, your body will create antibodies to fight, like soldiers that are helping your body to fight any foreign substance that's coming inside your system. So now, we as scientists, what we did, then we developed a test to test if your body has mounted that system, okay, to fight the infection. So I'll bring it in a concept of COVID-19. So what's now they've done, they've got some people have developed antibody, have developed those soldiers to fight the virus, which is COVID-19, which is a SARS-CoV-2. All right. So now the test that they call the antibody testing, it's actually testing if you have now enough immunity to fight the virus.
Right.
Okay. So then they will test IgG and IgM. Those are the antibodies against the virus. It's not a diagnostic. They just want to know if you have been exposed to the virus or not. At the current situation, okay, doing the literature review and many studies they've done across the world, according to me, I come to the conclusion that the test itself, it does not bring good clinical contribution to this pandemic. Because I'll give you a few examples. Some individuals, they develop the antibody 14 days after being exposed to the virus. Some individuals, they only develop those antibodies 4 months after. Some, they don't develop at all, up to now.
Right.
All right. Now, I'll push it a little bit further. Some individuals that there are some cases like in France, some individuals that they were infected with SARS-CoV-2 and they developed the antibody, IgG and IgM. They were so happy, now we have the immunity, now the virus can't get me anymore. 2 months down the line, they get the reinfection.
Right.
Okay, so currently, it's still experimenting phases. The antibody testing, to me, it doesn't add more value. It's peace of mind, and at least you're the lucky one, you had it, and now you know that you had it before, you have some antibody. But it does, until today, there's no study, there's no study proving that those antibodies is convey immunity to you against the virus. No, you can still get infected, even though you have the virus. Even though you have developed antibody against the virus.
All right. So let's talk about, it's now coming towards the festive season. People are wanting to go on holiday. When you do this test, how do you know how far in your infection is, or do you start quarantining yourself only from the day you find out? Because a lot of the times people go for the test, once they've received symptoms, maybe 2-3 days later. How would they know, Doc, where is the infection maybe there? Had it been there for a few days or not? Does the test normally tell you?
Yeah. That's a good question. Actually, good that you asked that question. I'll give a little bit of light because we've been also traveling this past 2 weeks. So what's happened? There's now a worldwide regulation that before you travel, you have to conduct your COVID test. You have to prove that you are negative. Then you can board the flight or the bus and so on. Coming to the reality, what we have noticed, because we are the service provider, and these people are coming to us. So what we have discovered is that when you're traveling using a flight,
yes,
okay, they will make sure you have your PCR COVID-19 test. It must be important. Do not get it wrong. It must be a PCR COVID test. Then you will be able to board your flight.
Right.
Okay. But what we discover, we see like some of our competitors sitting at the board of I think what's that board again? Bedbridge. They are testing only COVID-19 antibodies and issuing results to the passengers and to the travelers, and they're crossing the board. So
right.
yeah, so we advise people it's cheaper to use the antibodies and antigens. If you're going maybe to Malawi or to Botswana or somewhere, you're crossing the board, the people that do not have they do not have the knowledge of knowing that the antibody is not
Yes.
actually a COVID test. They're just letting them
Yes.
go. But if you're boarding the flight, you need to have your PCR testing. But other borders, they don't. They only check. Oh, it's COVID negative. Let you go. All
Right.
right. That's the first part of the question. The second part of the question, you want to know if our testing can tell you what phase of the virus,
Yes.
what the viral loads in your system, so on and so. We have a tool called the city value. When we do our RT-PCR, which is your actual diagnostic of COVID-19 test, it will give you a city value. That value more or less give you an idea,
Right.
of how far you are in your circle. The lower the value is, high infectious you are.
Right.
The higher you are clearing the system. So it goes on a curve of 0 to 30.
Right.
So when you get infected, maybe it's around about 7, and then you are really high infectious. Then it goes 12. The curve goes high, and then you reach maybe 14. That's at peak of the virus that you're highly infectious. And then it starts going down, and then day 5 or day 6, day 7, until to reach 30, which is at the lower end of your curve, and then it's your clears as negative after that. So that's the only tool that's giving us. The city value is giving us a tool. If you see your city value is 28, then I'll know the virus has been in the system maybe for 7 days. And it's not
Okay.
maybe 3-4 days will be cleared. If you are 12, then I say no, you need another one. So that's the only tool that we can use currently to assist the people.
That has definitely helped us in many directions. At least we understand it better now. What
Thank
message would you
you.
like to leave our viewers with this afternoon from yourself and Hamadi Lab?
Well, we appreciate your invitation, and Hamadi Lab, we just wanted to make sure that people they understand what Hamadi Lab is doing. Hamadi Lab is meaning to the house of blood. We are a growing company in this country, pathology company. We are making a lot of remarkable change in the industry, from the turnaround time, from bringing the pathology next to the people, from the cost effectiveness of the testing itself. Like our competitors, they charge 100% rates. And we will come like we offer it for 75 at same quality, same equipment, same university, same qualification. We give that 75%, and people out there, they start to understand now that the pathology is not a monster. So people should understand that they shouldn't be afraid of getting those bills that they're getting of 2, 3, 4,000 rand. There's an alternative in this country. They shouldn't worry about it. When they think about pathology, they think about it's expensive. It's those people. No, there's a player like Hamadi Lab, which is a leading force now in this country, and the cost is very good and very good quality, and you get it at the convenience of your home. We're coming with a very good innovation where we bring a salivary test. You can be in Gauteng, for example, and at your home, and they just order a card. We send the card to your house. You spit on there in your card. You send it to us, and we test you, and they say, okay, you have diabetes. Those are the ways that we are taking the pathology in this country. Cost effectiveness, and at a good price, and very, very, very convenient for you, for your doctors, for it as well. So you don't need to travel all the way to come to see your doctor, to come to the lab. You just press it, prick yourself, send it back to us. can use Amazon, you can use any other other shipment company, and you get your results. You get your results. Yeah, everything is digital. And another thing that we want to add as Hamadi Lab, we are partners. We are partnering with the big stakeholders, people like Discovery. We are partner with them. It's phenomenal. You don't even need to go on our website. If you're using Discovery, for example, you get your results right in your application, and the doctor get the result right in the application. It's fantastic innovation that Hamadi is bringing in this era of pathology. I hope people they can do more research and get to know about Hamadi more and realize that the pathology it shouldn't be so much expensive as it's perceived to be in a country. There is an alternative. That's the message that I want to give to the people.
Thank you so much.
An alternative. Yes.
You know what? We want to thank you. Firstly, you spoke about you charge only 75%. But you're charging 75%, but you do realize you're giving 150% back. So we want to thank you on behalf of the public for literally what you're doing, because you're going that extra mile that nobody else has done. You've taken those steps of being selfless and giving back to people and empowering them by helping them, by going to them instead of expecting them to come to you. And you've, of course, created that affordability. As we know, a lot of the people that stay in the rural areas and the townships cannot afford this, but you've created that affordability for them so they can get the necessary healthcare. So we want to, from myself and the team, definitely commend you on the type of work that you people are doing, because it is definitely a lot of selfless work that you are going out there and you're affording the community and empowerment in a different manner. Thank you so much for joining us this afternoon, Dr. Patrick Mufolo. You have definitely enticed us into a very good space this afternoon. We know there's hope out there for all those people that need that healthcare.
Thank you, Nafeesa. Thank you for your invite, and we appreciate all kind of what you guys are doing out there. Thank you for your support, and we are together. Thank you.
Most definitely. We wish you nothing but the best, and thank you so much for joining us this afternoon. And of course, you do stay safe and take care. Very good afternoon.
Thank you. Bye-bye.
Bye-bye. That was Dr. Mufolo, definitely giving us some great insight into Hamadi Lab. What an amazing, phenomenal company, going out there, creating that affordability, the environment, going, of course, to those people, selflessly getting in there and getting in, proactive, should we say, reaching out to those people that are finding it very, very difficult to go out and find that particular healthcare. A very phenomenal afternoon for us here at Salam Media with Hamadi Labs and, of course, all our other guests that we had this afternoon. But we've really run out of time. So myself and the team, we wish you nothing but a wonderful week going forward. And we're going to play out with We Begin by MS Moem. From myself and the team, Assalamu alaikum wa rahmatullahi wa barakatuh. Have a lovely one.